If you can't for any reason, feel free to move over into this direction. Okay. So starting with an introduction to myofascial release, it can be done anywhere on the body. Today I'm going to be beginning on the abdomen and chest because of the persistence of upper cross syndrome is what it's called, or hyperkyphosis in our society. So many people have a tendency to lean forward or to be forward in most of their jobs and in their posture, that our fascia along the anterior side of the body tends to shorten from our hip flexors here, quadriceps, tibialis anterior, the dorsum of the foot, straight up through rectus abdominis, the sternum, somewhat through the pecs, that's your SCM to the back of the head. So today I'm going to begin with something that I may use names or terminology that are strictly unto my own practice that you may not find in other books. So if you ever have a question about what I'm doing, just ask. And I'm going to start with the lateral side of the abdomen. Firstly, when you're first introducing touch, it's nice to start at the hip and the shoulder and then go to the abdomen. I start at the side rather than right on the top. Sometimes I find it's easier for people when I'm introducing touch instead of coming directly in, just to come to the side. When you're doing myofascial release, you want to be in a comfortable position so that your shoulders are relaxed, your knees are relaxed, your low back is relaxed. You'll see me often rotate my head to make sure that my neck is still in a relaxed position. And then you want to allow your hands to sink. So I'm starting with just introduction of touch to the skin, and then I allow myself to sink through the layers of the cutaneous fascia, cutaneous membrane into the subcutaneous region. Once I'm through the skin, I can start to move planes of tissue or fascia from a deeper level. And the one that I'm starting with on the lateral side, I can move my hands in opposition to see if there's any tension that I feel. And then I'm going to start with the general pulling at the lower ribs and the rib cage, just from the thoracolumbar aponeurosis, gently pulling and releasing. Starting to get some movement. You'll see me, it's a waiting game, so you'll see me start to move slowly. And with each breath that the client takes, they can take this a little bit further. And then I'm going to start to come with it. Okay. And I'm going to come up to the abdomen and start to work on the four corners. And the four corners, when I'm referring to the abdomen, are the upper corners of that are lined by the diaphragm on either side, and then the lower corners that are the pelvic bowl on either side. So I'm going to start by pulling at a diagonal direction up, gently, just away from the pelvic bowl. And I'm just holding relatively pretty superficially, I would say. And I can move my body so I was pulling towards me. That's better. And you're going to get something that a lot of people call hooking tissue. Okay? So there's this level where I can pull on the skin where it just comes with me, right? But what we want to do is sink into a layer where we're really hooking into the fascia and then pulling it towards us, which you'll start to feel the difference today. Do you feel that pulling down your lateral leg? Mm-hmm. Yeah. That'll come all the way down the ITB, and you can feel that pulling all the way down through here. Especially right here. Mm-hmm. Especially right at the pelvic bowl and the ITB, or that tensor fascial lateral, which is not uncommon. So now, just from that basic movement, this side has quite a bit of flexibility, and some redness and some warmth to it now that it's released, whereas the other side has no movement in comparison. Can you see the difference? So this side because of this side of the table I'm standing on, I'm gonna push towards the opposite corner, and I'm hooking underneath my palm and moving towards that shoulder. And once I feel some release with that, I'm going to go into rectus abdominis, which I can move directly up and through, or I can grab the edges of it and move up to release it as well. There we go. Good. Okay. And then coming down from the diaphragm, hooking that tissue, and then going down in that direction. Okay, and I'm gonna go right.
Mm-hmm.
Did you feel that release? That felt pretty big. That felt like it was coming from a lot of different areas.
Yeah, it
didn't
was.
Through your shoulder at all?
Mm.
Yeah. And then this side. And that will really open up the abdomen, and go ahead and take in a deep breath, and you can feel. What's that feel like?
Kind of feels like a weight's just been lifted off.
Mm-hmm. Okay, cool. All right, so that's what the four corners is whenever I talk about that. And then the pulling on the lateral sides from the thoracolumbar app is just pulling tissue towards the abdomen. Right. That's all that is. Okay. The other thing we can do, there's a lot of things that we can do here. One of the things that I'd like you to experiment with today, as well as the four corners, is sort of, there's two lateral sides here that naturally divot in where the psoas is, and it's right on either side of the abdomen. And I often will hook that and then just gently rock. I don't go in very deep, literally just deep enough just to grab the fascia, and then I'll just jostle gently, not very fast or hard at all, just very gently rocking. And if I stick with this for about 30 seconds, it'll start to let their low back lay down against the table, and we'll really release their low back. There you go. One more deep breath. And that's me using the client's breath to release what's happening. There you go. And then I'm gonna let go, and you feel your back laying down a little bit on that side. Can you guys see the difference between the two sides at all? So this side is really up and off, and this side smoothly has like a divot where the psoas is. And now I'll do this side. And so right there, I couldn't really get a good grasp before I was going across the midline. So when I'm gripping, I can come in and gather tissue and then grip it with my other hand. And breathe in a couple deep breaths. This side's tighter, huh? There you go. One more breath. Thanks. Okay. And then both sides are falling nicely against the. So we'll try that today. And then put that under. Great. Up here at the pecs, I'm going to leave that there for a minute for security. What I wanted to show you. So pectoralis, you can see how the shoulders are coming off of the table, right? So, again, working on pectoralis major, I could have started with the back. It's sometimes easier to show on the back because there's this huge broad, swaths. But I don't want to start somewhere where very few people do the work, right? I want to start somewhere where a majority of us will actually feel some sort of a change structurally today. And this will be it. So you'll come in across the sternum, sinking into the tissue. You want your whole hand to be at about even pressure when you're finding that fascial level. Once you've found that fascial level, then I'm going to take it and pull to the opposite side. I'm headed that way. This is called broad plane release. So I'm not sliding over the skin, and I'm not using any lubricant. There's plenty of oil already on the skin. Your client produces enough oil for this. Sometimes if people are really, really dry, or if it's pulling hairs, I'll use a drop of lotion. There you go. Okay. And then you can start to see, just even from one stroke, the change in the shoulder level. It'll start to drop a little bit. Okay. Does it feel any different? Yeah. And then I'm going to come along the side of the clavicle. And I'm going to start just moving the tissue. Sort of a C or an S, if you will, where it's really tight, just in opposition. And deep breath. There we go. Excellent. All right. Like right here. Okay. Is that better? So when I'm pulling in towards the sternum, you can really see across the shoulder blade where it's pulling from. Alright, it should be right through here and through the deltoid. When we're over the sternum, we're going to find where there's fascial resistance and gently move in either direction. And just hold and we'll kind of breathe, and they can stretch that for you. There you go. So pec major, pec minor is right here. And to address pec minor, I'm going to show you something called a pin and stretch, where it's a deep tissue technique where you can hold like different layers and then stretch the client's arm, or you can have them move it one way or the other. You just gently take it to its end feel where it stops. Is that too big of a stretch, or is that okay?
That's good.
And take a deep breath, and just have them take a couple deep breaths. So I'm pinning the muscle towards the opposite, like towards there, down and then that direction. Can you guys all see and understand what I'm saying? Yeah? Okay, great. Down and then that way, so that when I stretch the arm, that the fibers are actually getting longer. There you go. You feel that release on it? I remember. There you go. And then when we get to the arms, we'll talk more about the anterior deltoid and subscapularis as contributors to medial rotation of the shoulder. But for now, we've opened up the abdominal region, the sternum, and throughout pectoralis major. Okay? And that's where I would like to start today. And so I think that'll end our demonstration.